Gotcha. So the idea that this hearing aid's a magic bullet, it's going to be put into your ears and you're going to be set is a myth. There's a lot of work after the fact that needs to be done.
Right. If you want to offer best practices, you have to spend a lot of time with the patients. The managed care folks force us not to do best practices because of the limited time that we have with these patients, because they're not private pay, and the insurance companies will just pay us a fitting fee, and then after that they're not paying us anything at all. They expect the patient to start footing the bill for the follow-up services. So it could cost the patient, $100 a visit, after 9 months of wearing a hearing aid. And so the patient may be reluctant or resistant to come back to my office because they know that they have to pay me a fee for my time because the insurance company is not covering it anymore. So they may blow off the follow-up care. So you're certainly not even getting close to best practices. If the patient is fit privately, then there's no charge for follow-up care. And on average, we see our patients 4 times a year. If you're investing a lot of money in hearing aids, you want to make sure that you're maximizing your ability to hear from that hearing aid. And it's a sophisticated little medical device. It requires cleaning, adjustments, just like anything else that has a computer in it.
Gotcha. This isn't like braces where you put them on and
Right.
they're in there for a while. But even braces need a lot of adjusting. But they're advertising this fact that, hey, we'll give you this big piece, but they're leaving out, maybe the most elaborate, maybe the most cost-intensive part of the whole process.
Right. If you unbundle the cost of the hearing aid versus the time that we're spending more time than the actual cost of the hearing aid. So that's factored into our cost. But, if the average life of a hearing aid is 5 years, you want to see the patient for at least 15 visits, because that's part of what they're paying for. And there could be software updates, performance updates that we can put directly into the hearing aids. We have ways to internally clean the components. All of that is part of providing best practices, and you can't do that if you're providing service for a managed care plan. It's impossible.
So I know we had talked about this earlier, but just for the listeners and viewers, the managed care plan, these are third parties, these insurance companies outsource the hearing responsibilities to, correct?
Correct.
Okay. And in your experience, these managed care plans, are they only really in the Medicare Advantage sector, or is that the only?
Thanks again for tuning in to Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we will see you in the next episode.